Is psychiatric disorders in India separate from rest of the world?
There are differences. Some conditions are more common in the West, post-traumatic stress disorder, eating disorders even. On the other hand, some other conditions like trance and possession, speaking like a dead relative, speaking like a god and all. Those conditions are not that common in the rest of the world.
In India, do we have a good social support apart from rest of the world?
Though it is gradually declining, we still have people living with their families, the family supporting.
How many people are suffering from mental health disorders in India?
Around 14%, 14% of Indians have some kind of mental health issue.
Addiction cases are increasing throughout the world. What are exactly the reasons?
So the increasing availability, the increasing financial ability, and also the media, like social media, and all. There is a lot of, even in the movies and all, there is a lot of glorification, glamorization.
They are asking a day off or 2 days off in view of consultation. They are apprehensive if their bosses will come to know they will be terminated.
Discrimination on the basis of mental illness is absolutely.
Behind every calm face, there may be storms unseen. Behind every smiling face, there may be struggles and emotional pain. In today's world, is silence becoming our most coping mechanism? Let's find out today what it truly means to be mentally healthy. We are honored to have Dr. Shahul Ameen. Dr. Ameen is HOD at St. Thomas Hospital, Kerala. Apart from that, he is also a direct council member to the Indian Psychiatric Society. Tell us why you have chosen psychiatry, why not any other field?
Okay, that's a difficult question, to be honest. So actually, I was not personally interested to take up medicine as such, because my interest was in arts and areas like that. But again, like that time, maybe 30 years back, like in any family, people will want to have a doctor anywhere. So many family members told me that no, you are getting good marks in school, and also you should try medicine and all. So I thought, okay, I will go for medicine. But I was not able to properly cope with the kind of stress that a medical college offers you. Again, my mind was still inclined to more towards arts and things like that. Then some seniors and all told me that within medicine itself, you have fields that come close to arts, that deal with human mind and emotions and behaviors and all. So you can choose psychiatric. So like that, I thought, okay, then that way, at least with such an aim in mind, I can at least finish my MBBS without much stress and with a point of hope in my mind and all. So I thought, okay, when by the time I was in my second year or something, okay, I will look for psychiatry. That was one of the reasons. Then I started reading more about that, and then I thought that maybe this is an area that fits with my like a personality and my goals and ambitions and all.
So that is how you came into the psychiatry. So it's been a lot of time since you have been you have been in psychiatric field.
25 years now.
25 years now. That's a huge time. Tell me, is India and psychiatric disorders in India separate from rest of the world?
Actually, whatever we are following is like international classifications only. When we diagnose a patient, we are using classifications made by either American Psychiatric Association or the World Health Organization, ICD-10. At the same time, if you look at the presentations, there are differences. For example, some conditions are more common in the West or the rest of the world. For example, post-traumatic stress disorder, conditions like that. Eating disorders, even anorexia nervosa, where people don't feel like eating food. They want to remain very like undernourished and very low in weight and all. Those conditions, though very described in our books and commoner in the rest of the world, we don't see many patients in our settings in our country. On the other hand, some other conditions, like for example, what we call trance and possession, where one person starts behaving as if another person has possessed, like speaking like a dead relative, speaking like a god and all. Those conditions are not that common in rest of the world. Those conditions we get here more.
And what about social support? In India, do we have a good social support apart from rest of the world?
Exactly, we have, because we have still, though it is gradually declining, but in most of the most portions of the country, we still have people living with their families, the family supporting the parents, siblings, everybody supporting, the extended family supporting and all. Earlier, when they did some studies, this IPSS or FACAS and all, where they studied how the patients with schizophrenia perform over the years. So they found that in India the outcomes were better compared to even some of the Western world, because one of the reasons was that there is the family to support the patient, unlike in some of the more advanced countries.
Okay. So, in this profession of psychiatry and psychology, if we talk about communication, for example, a doctor and a patient, or a psychologist and a patient, do you think talking to them in their own native language is good? Is good?
Well, this always helps. In India, actually, we have so many languages, but many people are now conversant with Hindi, English, and all. But obviously, if you speak with the person's native language, mother tongue, that may help create a better relationship, a better rapport, and that may even give the person more courage to open up with you, and all. That always helps.
Okay. So, Dr. Shaul, tell me if there is any research or data available in the area of mental health, in which we will come to know how many people are suffering from mental health disorders in India.
Okay. In India, the best and biggest study that has happened, the last one was the National Mental Health Survey that happened in 2015-16. So now the second phase of that is being planned. It will happen in the coming 2 years. So as per that, about 10 years ago, it found that around 14%, 14% of Indians have some kind of mental health issue.
14% of the population.
Because
Okay.
it was not done in the hospitals and all. It was door-to-door survey. People who home they visited and checked every member's mental health. Another the most important finding is that about 70 to 80% of people who have these issues, they have never sought treatment.
Oh,
So there is a huge.
so that is the problem.
The
basically.
treatment gap is huge. Most of the people, they don't know they have the illness, or they are not willing to seek treatment. So all these kind of problems were identified.
Dr. Shaul, tell me about addiction, because addiction cases are increasing throughout the world. What are exactly the reasons, if we talk about today in 2025, and if we talk about before 15-20 years?
The addiction was there even before, not to this extent. Like say, I can talk about my experience in Kerala in the 80s and 90s and all. People used to smoke, or most of the adults used to smoke. They used to chew the betel and tobacco and all. Those kind of addictions were there. And alcoholism was also there, though I grew up in a Muslim dominant area, so there alcohol was not that common, but in other areas also people used to drink and all. But over the past maybe around now it is 40-45 years, the major change that happened, at least where I live, like I can talk more about my Kerala experience. So what happened is at least in that middle class families and all, even the lower middle class families, they have a better income. Compared to those times, many people went abroad, many people got educated, and so that overall financial capacity has at least slightly increased. In the rich were always rich, but the middle class, lower middle class, they have slightly more expendable income with them. So the children are seeing that, growing up, seeing that money and all. So because they have access to these substances through various channels, they have the money to procure
Available, yes.
to all those. And also even they have more opportunities, like they do some works like catering and maybe some, this is Zomato, Swiggy, they're kind of selling, and or maybe adolescents are joining those kind of jobs and using the money to procure substances. And when there are those who want to buy, obviously the supply chain finds them. So there is always people even though even in Kerala we have these nicotine products are banned, but most of the students I treat, those who are in 6th standard, 8th standard, they have a lot of availability. Like it is very easily available to them despite the ban and all. So the increasing availability, the increasing financial ability, and also the media, like social media and all. There is a lot of, even in the movies and all, there is a lot of glorification, glamorization of. Although they show that disclaimer,
heroic faces and all that.
even then, like there is a lot of glamorization, so that also influences the social media. There are groups like social media groups and which
So glamour also impacts them.
yeah,
in a
glamour media all are becoming motivating factors.
So, what do you think if we talk about the social media right now? We have different types of platforms available. Do you think it helps us now to aware the people, or it is already worsening the situation?
No, there is always scope, like primary prevention, secondary prevention, all there is still scope. Only thing is we have to talk their language. That is the problem. Now, if you like, maybe if you 20 years ago, if you wrote a 500, 600 word article, people would have read that. Now, people don't have that kind of an attention and all.
Exactly.
Because they are now more, like the attention level is that of the reels and things like that. So, you'll have to create such brief snippets of information and use them as ads or things like that. So using social media and other channels and awareness classes and all, there is still hope. I don't think like everything is lost. Only thing is like we have to speak their language. We simply go there and advise them that this is harmful and all. That may not be beneficial. Like unilateral.
It should be very impactful.
And to make it impactful, it should be more of a collaborative.
Exactly.
Rather than you going there as an expert and you trying to threaten them.
It should be a
them and
collective effort.
It is better to have some people from among themselves.
Definitely.
Like many of them, like people of their age who used to use substances but have now stopped. So those kind of people, they will have their own experiences to share, what they lost by the substance use, what they gained by stopping the substance use.
Exactly.
So if they like narrate their stories and all, it may be more emphatic than a psychiatrist or a psychologist or any teacher giving a lecture. So we have to change the methods actually to suit the needs of the current population.
So, Dr. Shahul, you are visiting Kashmir frequently, I can say now. And for me, this was a great opportunity today. You came to the studio for this podcast. You interact with many people here, be it psychiatrists, be it psychologists, or many professionals who are already working in this area. Do you think apart from rest of the India, we are lacking something or where we should improve exactly?
I don't have that kind of an exposure to the mental health care system of Kashmir to give that kind of advice. I have spoken to people, but to give this kind of suggestions, one has to spend more time and speak to more people and all. But wherever in India, actually, there is a shortage of trained manpower. Like all over the country, maybe except in some places like Bangalore or Kerala or places like that. Most of the other places, there is a shortage of actually trained mental
Trained
there's a lot of quacks are taking their place and all. And there is a need for better liaison between different mental health specialists like psychiatrists, clinical psychologists, social workers, etc. Better referral patterns and better awareness and better relationships. All these are needed everywhere.
If we talk about depression in general, most of the people are right now complaining of depressions from every nook and corner of the world. Is it increasing because of the lifestyle changes or there is something else?
No, one thing is all these claims, whether they already have a clinical depression, that is a different thing. Because like all these have to become the buzzwords now. Depression, delulu, delusional, narcissistic,
Definitely.
toxic.
Everybody uses those words.
Is using. So whether that terminology matches the scientific terminology, medical terminology, that we are not very sure. Another like aspect is that people once they are more sensitized, maybe they will recognize earlier. Compared to 30 years ago, when somebody feels sad, people may not know that this is depression. But now there may be early recognition and more cases are being detected. That may be there. But added to that, this is also there. Like even the normal like low mood that follows somebody's death or some separation, breakup and all that may falsely get labeled as a clinical depression. That is also there. So it is actually increasing and all. We cannot tell without sufficient data. I don't think we have that kind of data. In the 80s, 90s, what was the prevalence of depression and all that kind of good quality data compare with the current rates, we don't have.
Doc Sab, you have been into this profession since 25 years now. If we talk about before 20 years and now, because we are in a more scientific approach, we have social media available, we have a lot of things which is now quite different from 20 years before. Do you see any changes, and how excited are you today's technology is going to help us in mental health after 2025?
The technology is a double-edged sword. It can create its own mental health issues also, and also it can help like in solving mental health issues. The helping methods, I can say that like especially in psychiatry, we don't have a lot of what are the genetic components, what are the underlying biological reasons and things like that. We still don't have enough idea. But once we have this big data, the information from lots of patients that combines both the clinical information, the blood tests, the neuroimaging, everything combined, and if we give these to the AI tools to analyze and to find patterns and all, we may get better picture of why mental illnesses happen, so that we can take preventive measures and develop better medications and therapies and all. These kind of advantages are there. Even though AI is already is being used to go through social media posts and to see whether somebody is suicidal. These kind of studies are also happening. From the change in the tone of somebody's social media posts and all, people are diagnosing depression or suicidality and all. So again, there are some tools which give therapy, AI-based tools, chatbots and all, which give, though they are not foolproof yet, but there is a lot of research going on. It is a rapidly advancing field, but there are tools. Even before AI, also there were chatbots that were giving therapy. But now it is even improving. So especially in places like India, where we have a dearth of professionals, where there are access issues. Many people are in villages and travel time, everything considered. So all this can be beneficial. At the same time, the technology itself is causing a lot of issues like sleep deprivation, and as we already discussed, the spread of the increase in the substance use and relationship issues, jealousy, the comparison with others, leading to maybe depressive and anxiety symptoms. So this again, it can be both ways.
Yes. So, Doc Sab, tell me one more thing. For those persons who are already dealing in the area of mental health, how they can take care of their own mental health, being a professional, a psychiatrist, a counselor, or a psychologist.
So one thing is, once they feel that they have some issues, they should not take it lightly. I am a professional, I know what to do. That kind of attitude should not be there. So they should not hesitate to seek help from any colleague. That is one thing. Then as the usual advice goes, one, it should not be the job alone. One should have some hobbies, other interests, some free time, some family time, travel, whatever, music, whatever hobbies, exercise, sufficient sleep. It should be a healthy, balanced.
As normal as others are doing.
Yeah.
Okay.
That part should be there.
So they should not run it like 24/7,
Exactly.
being in the job and doing nothing else. They should take care of their hobbies and other things also.
That work-life balance that we call it, that should be there. And most importantly, there should not be hesitation to seek professional help.
Doc Sab, do you still see there is a stigma in the society for seeking consultation with a psychiatrist?
Stigma is still there, but compared to say 20-25 years ago, it is much less.
Okay.
Maybe again because of the social media, the awareness, everything that is happening. And also by now many people know that these treatments can work and help, because there are a lot of people who have recovered, who have shared their stories in social media, etc., etc. So that way the stigma is less, because decades ago leprosy was highly stigmatized.
Exactly.
But the medicines came and it became highly treatable, and all now there isn't much stigma attached to that. Likewise, now people know that there is treatment with medicines, with counseling, with therapy. These conditions can improve. So there is much less stigma.
Okay. Can a psychological intervention go alone, or it should definitely have collab with a psychiatrist?
That depends actually. That is a highly controversial question, and there is no one this is the final answer kind of thing.
Okay.
It's always better to get a medical opinion, because many of the symptoms could be the reflections of the manifestations of some underlying medical issue, about which the non-medical professionals may not be trained to detect. For example, I will tell you one case that I had. One boy studying about 5th standard.
Okay.
He was brought to me, and his father told me that he does not have attention.
Okay.
He does not study well, he needs counseling. So when I took the history, I came to know that what he is suffering from is basically absence seizures.
Okay.
So for 3 seconds, he goes blank.
Mhm.
So I made him hyperventilate. He had an attack in front of me.
Mhm.
I took the EEG. There are all the changes.
Mhm.
But if they have gone to any counselor and all, this
They would have done the counseling.
the counseling only, but this would have gone undetected.
Hmm.
So it is always better to get, I won't say psychiatrist itself, especially considering the dearth of psychiatrists in the country. So at least a medical evaluation is needed to rule out that whatever the patient is showing is not a part of some other medical condition. After that, like even for mild to moderate depression, and we know that both the medicines and the non-pharmacological interventions both are equally effective. So in that cases, it is absolutely fine that after the screening, if only therapy is happening. But for conditions like say dementia or psychosis, bipolar disorder, severe depression, for that we need medications also along with the non-pharmacological interventions, at least those conditions.
Exactly. So, Dr. Shahul, tell me how important is to talk about mental health at workplaces and educational institutions?
They are very important because we have every other day we have news of suicides from either because of job stress or even students and exam stress and issues with the colleagues, issues with classmates, issues with teachers and all. So especially about communication, about stress management, about relaxation, all these people need training. Even in Kerala and all, that is a part of the curriculum now. These teens are trained on some of the positive psychology techniques. So that may be helping. We haven't evaluated that objectively. But this kind of should be part of the curriculum rather than teaching them all the unnecessary history and the geography and things like that. It is better to incorporate these kind of time management skills, stress management skills, communication skills, drug refusal skills, sleep hygiene. All these kind of techniques should be part of the curriculum. That is what I feel.
If we talk about a corporate system, if somebody is ill, he or she takes a leave and they are asking a day off or 2 days off in view of consultation, that they need a consultation with a physician or orthopedician or someone else. What is stopping them to write a consultation with a psychiatrist if they have to write? Is something stopping them, or they are apprehensive if their bosses will come to know they will be terminated?
No, that should not happen. The discrimination on the basis of mental illness is absolutely not allowed in India. As per Mental Health Care Act that came in 2017 and all, there should not be any discrimination on the basis of.
So anybody can write easily. There is nothing to worry.
Ideally. But anyway, in the practical level, people may think differently. But ideally, there should not be any discrimination. Even we have reservations on the basis of disability and all in many posts and all.
So, Dr. Shahul, thank you so much for your time. Just give us a one message that everyone should know about mental health.
No, take care of your health, not only mental health or physical health also, both are highly connected. So get sufficient sleep, stay away from substances like alcohol and cigarettes and all. And if you feel there is any issue with your sleep, with your mood, with your memory, with your appetite, which is persisting, which is severe, which is distressing, don't hesitate to contact a mental health professional because most of these conditions are treatable. And if not treated, they may have their own complications.
If we are talking about good organs like good heart, good brain, good liver and all that, if we are talking about healthy mind and healthy thinking, what exactly do we mean?
No, mind is a product of the brain only. So for that, we need a healthy brain. For that, we have to get adequate sleep. We should relax sufficiently. We should not use any substances that harm the brain, like alcohol or other substances. We should take nutritious food that includes proteins, vitamins, and all that helps the brain function normally. All these are important for the brain's health and mind's health. And the psychological health means anger management, then communication skills, relaxation techniques. Then when you are getting a negative thought, how to identify that and convert that into positive thought. All these kind of skills one has to learn.
How important is training of trainers if we talk about mental health? How important is getting trained after every 2 years or 3 years, once even if you have become a psychologist or psychiatrist?
No, all the fields are very rapidly evolving now. Like it is said that in the medicine, every 5 years the knowledge base doubles.
Okay.
So obviously one has to keep updated about the new studies, new kind of therapies, new kind of medications, and all. And also new kind of illnesses that are coming.
Exactly.
So keeping updated is a part of the process anyway.
So
That-
training is
that
equally
is needed,
important.
That is needed.
Thank you so much, Dr. Shahul.
Okay,
Thank-
thanks for the opportunity.
As we end today's conversation, we learned that healing is not about perfection. It's about connection and living with dignity. If today's episode made you pause and reflect, reach out, talk, and learn. Hit that share and subscribe button. Maybe someone somewhere needs it the most. Till then, be happy. Enjoy small moments with all, because mind heals best when it's not alone.